Bone-on-bone osteoarthritis. What is it and what does it mean for your painful joint? That's exactly what we're going to talk about in today's video, starting right now. If this is your first time to the channel, my name is Luke. I'm a physio based in the UK with a special interest in osteoarthritis, and I bring out osteoarthritis help every single week. Hit the subscribe button and the notification bell so you don't miss any of it. So I see patients on a weekly basis that have been told by their GP or consultant that they have bone-on-bone osteoarthritis. It's very common, and understandably, they are worried and anxious about what they should and shouldn't be doing, and also what it means for them further down the line. Now, I'm hoping at the end of this video, you're feeling slightly more reassured and slightly more confident about how you can go about dealing with your bone-on-bone osteoarthritis. Let's take a look at the anatomy of the knee to understand a little bit better. Now, in these two pictures, you can see a front view of the knee and a bird's eye view of the knee. In your knee, you have two different types of cartilage. You have your meniscus and you have your articular cartilage. And these cartilage have slightly different roles. Your meniscus is your shock absorber. It is the in the knee. And then you have your articular cartilage that lines the surface of the bones, and this is designed to act as a nice smooth surface so that you have frictionless movement when you're moving around. Within the knee, you have three different compartments. You have the medial compartment that houses the medial structures on the inside. You have the lateral compartment that houses the lateral structures on the outside, and then you have the patellofemoral compartment, and that is the articulation where the kneecap articulates with the rest of the joint. You also have cartilage on the backside of the patella. Generally, osteoarthritis refers to changes within the articular cartilage, so the cartilage that lines the surface of the bone. Having said that, osteoarthritis is very closely linked to inflammation. And if you do have inflammatory processes occurring within the joint capsule, the inflammation doesn't just isolate the articular cartilage, it has an effect on the other soft tissues as well. So it can affect your meniscus and ligaments and tendons like your ACL or PCL, which can cause sensations of giving way or instability. Osteoarthritis is an exceptionally common condition. It affects around 9 million people in the UK and around 55 million people in the US. And obviously, as our aging population increases, we're expecting these numbers to increase. So it's important that we understand there's a massive spectrum of severity when it comes to osteoarthritis symptoms. At one end, you may be able to run 10 kilometers or play a 2-hour tennis match with a little bit of stiffness in your knee the next day. At the not so good end, the more severe end of the spectrum, you may have night pain and you may struggle to weight bear, which is why when you are thinking about a treatment plan, it's important that it's tailored and specific to your level of function and pain. So what do we mean when we say bone on bone? Well, take a look at this grading score. Now, when radiographers comment on an X-ray, they will use this classification. It ranges from 1 to 4, 1 being not so bad, 4 being not so good. They will comment on things like joint space loss or joint narrowing, osteophyte formation, which are bony spurs, and towards the latter stages of osteoarthritis, there may be some subchondral sclerosis, and this is where the cartilage has been worn away and more bone has formed as part of that healing process. And on an X-ray, it looks whiter at the edge of the articulating surface where more bone has been produced. This is what people are referring to when they say bone on bone. Now, bone on bone sounds worrying, it sounds scary, and it is definitely anxiety provoking. Now, here is the big caveat when it comes to X-rays. X-rays are a 1-second snapshot in time. They only look at structure, they only look at the joint. What they don't do is look at all of the other things that we know can affect the amount of pain you experience if you have osteoarthritis. Earlier in the video, I mentioned that osteoarthritis is closely linked to inflammation. And inflammation is a complex process that is affected by many different factors. It's affected by how much sleep we get. It's affected by whether we're stressed. It's affected by our mood, our thoughts, our feelings, our emotions. It's affected by our nutrition and the foods that we put inside our body. It's affected by whether we're overweight or not. If we're overweight, the way our body metabolizes fat means that we are in a constant state of low level inflammation. It doesn't look at how much exercise we get or how much we move during the day. So the more we learn and the more we know about osteoarthritis, the more we know that it is a complex condition affected by many different factors, and it's not just this old age notion of wear and tear, which is why x-rays often correlate quite poorly with pain. So you could quite commonly see somebody with a grade 1 or 2 x-ray with high levels of pain, or somebody with a grade 3 or 4 looking x-ray with hardly any pain at all. This is something that I see on a regular basis in clinic. So it's important that we use an x-ray as a small part of the overall picture, the overall picture being you, your level of function, the amount of pain you're experiencing and your symptoms, and not just treat the x-ray. We have to treat you as a person, not just the scan. All too often, unfortunately, I see patients that have been told by somebody they have bone-on-bone osteoarthritis, and they have seen a significant deterioration in their symptoms because they've been worried, because they've been fearful about moving, they don't want to wear their joint out more. This is not the case, and being advised you have bone-on-bone really, firstly, is not that accurate, and secondly, can be really unhelpful in trying to get you better. So what does this mean for you if you've been advised you have bone-on-bone osteoarthritis? Well, the take-home message from today's video is that even if you've been told this, your symptoms can still improve. Now, it may take some help and some support from somebody that knows what they're doing to put an appropriate plan in place for you to get your joint in the optimum environment for healing. But if you do that for an adequate period of time, there's every chance you'll see an improvement in your pain and function. If, however, you've exhausted conservative treatment, so non-invasive treatment, for an adequate period of time, you're still struggling with your pain and function, and you have an x-ray to back up that you do have moderate to severe osteoarthritis, it might be at this stage that considering an injection or surgery could be an appropriate option for you. I really hope you found today's video helpful. If you did and you're keen to get that joint moving, then check out some of the osteoarthritis workouts on the Genuine Physio YouTube channel. If you would like some tailored bespoke help, I do a very small number of one-on-one virtual consultations. You can find a link to those in the description below the video. If you've liked it, then like it, just down there. And if you're new, subscribe so you don't miss any osteoarthritis help that I bring out on a weekly basis. And whilst you're doing that, I'll see you in the next one.